Your blood pressure is at its most dangerous while you are sleeping. Not during stress, not after exercise, while you sleep. And most people with high blood pressure have absolutely no idea this is happening to them. But tonight, before you go to bed, there is one specific drink that the science says can begin working on your blood pressure while you rest. And I'm going to tell you exactly what it is, why it works, and precisely how to prepare it. Stay right here. Hello and welcome back. I am Dr. Carter, and for over 3 decades I have helped older adults manage their blood pressure, protect their hearts, and live longer, more active lives. And one of the most common questions I hear from patients is this: is there anything natural I can do at night to help my blood pressure? Not just during the day, at night, because they know their mornings are rough. They wake up with high readings, they feel it, and they want to do something about it before they even get out of bed. Today, I am going to answer that question completely and honestly. We are talking about the most evidence-based bedtime drink for blood pressure. I'm going to explain the science, the exact preparation, the dosage, the timing, and the important cautions you need to know. All of it verified against current research. If you want more content like this every week, please subscribe to this channel right now and turn on the notification bell. We are here for you every single week. Let us get into it. Before I tell you what to drink, I need to give you 30 seconds of context that makes everything else make sense. In a healthy cardiovascular system, blood pressure naturally drops by 10 to 20% during sleep. Doctors call this the nocturnal dip, and that dip is not optional. It is essential. It is the window every night when your heart rests, when your arteries recover, when the entire cardiovascular system repairs itself from the demands of the day. But here is the problem. Research has documented that a significant number of older adults do not experience that protective dip. Their nighttime blood pressure either stays elevated or in some cases actually rises. This condition is called nocturnal hypertension, and studies have shown that nocturnal blood pressure is actually a stronger predictor of cardiovascular events than daytime blood pressure. The damage accumulates quietly while you sleep, without symptoms, without warning. This is why what you do in the hour before bed matters so much. And this is why the right bedtime drink is not just about relaxation. It is about giving your cardiovascular system the best possible conditions to do its nightly repair work. Now let us talk about the drink. The drink I am recommending tonight is hibiscus tea, also known as sour tea, roselle tea, or by its botanical name, Hibiscus sabdariffa. You may know it by the name sorrel if you grew up in the Caribbean, or as carcade in parts of Africa and the Middle East. It has been used in traditional medicine for centuries across multiple cultures, and in the last decade, the clinical research on this plant has been genuinely remarkable. Let me walk you through what the science actually says, because I am not going to make claims I cannot back up. A comprehensive umbrella review, public direct in ScienceDirect in January 2025, analyzed data from 26 randomized controlled trials involving 1,797 participants. The findings were striking. Hibiscus sabdariffa dose-dependently reduced both systolic and diastolic blood pressure compared to placebo and other teas. The review found moderate to high credibility for therapeutic blood pressure reduction, exceeding 10 millimeters of mercury. And here is the part that is most relevant, Cligeu. The benefits were especially pronounced in individuals over 50 years of age and in trials lasting more than 4 weeks. A separate systematic review and meta-analysis published in Nutrition Reviews analyzed multiple randomized controlled trials and confirmed that hibiscus tea meaningfully reduces systolic blood pressure in adults with elevated readings. And a well-designed clinical trial published in MDPI examined blood pressure across the full 24-hour cycle, including nighttime readings. In the hibiscus group, nocturnal systolic blood pressure decreased, while in the placebo group, it actually increased over the same period. Let that sink in. Nocturnal blood pressure, the very reading that most strongly predicts cardiovascular risk, was improved by hibiscus. Quick question for you. Have you ever tried hibiscus tea before? Drop a yes or no in the comments right now. And if you have, tell me whether you noticed any difference in how you felt. I read every single comment on this channel, and your experience genuinely helps others in this community. Now let me explain the mechanism, because I think when you understand why something works, you are much more likely to actually do it consistently. Hibiscus flowers contain exceptionally high concentrations of compounds called anthocyanins. These are the natural pigments that give the tea its beautiful deep red color, and they are among the most powerful natural anti-inflammatory and antioxidant compounds found in any plant food. Here is what anthocyanins do inside your blood vessels. First, they act in a way that is similar to a class of prescription blood pressure medications called ACE inhibitors. ACE inhibitors work by blocking an enzyme that causes your blood vessels to constrict. Hibiscus anthocyanins block that same enzyme naturally. Your vessels relax. They open slightly wider. The resistance in your circulatory system drops, and your heart does not have to push as hard to move blood through. Second, hibiscus compounds stimulate the production of nitric oxide in the lining of your blood vessels. Nitric oxide is your body's own natural vasodilator. It is the molecule that tells your arteries to relax and widen. It is essentially doing what an entire class of blood pressure medications tries to replicate pharmacologically. And hibiscus tea delivers this benefit naturally, in a warm cup, before bed. Third, hibiscus has documented diuretic properties. It gently supports your kidneys in excreting excess sodium from the body, and as sodium leaves, so does excess fluid. Less fluid volume in the bloodstream means less pressure against the artery walls. This is the same basic mechanism behind diuretic blood pressure medications, but achieved gently through a plant-based compound over consistent daily use. This combination of mechanisms, ACE inhibitor-like activity, nitric oxide production, and gentle diuretic effect, is what makes hibiscus one of the most well-studied and evidence-supported natural approaches to blood pressure management available. Now let me get very practical, because the preparation matters, and I want you to be able to do this tonight. The most important thing first. Use dried hibiscus flowers, not hibiscus-flavored commercial teas. Many commercial hibiscus blend products contain very small amounts of actual hibiscus and a lot of added sugar, artificial flavoring, or other ingredients that work against blood pressure management. You want straight, dried hibiscus calyces. These are widely available in health food stores, online, and in many grocery stores in the international foods section. They are inexpensive, and a small bag lasts a long time. Here is the preparation. Bring 8 ounces of water to a boil. Add 1 heaping teaspoon of dried hibiscus flowers. Turn off the heat and allow it to steep for 10 to 15 minutes. The longer it steeps, the deeper the color and the stronger the concentration of active compounds. Strain the flowers out. Allow the tea to cool slightly so it is comfortably warm rather than scalding, and then drink it slowly, ideally 30 to 60 minutes before you go to bed. Do not add sugar. If the tartness is too strong for you at first, a small amount of raw honey is acceptable, but try to avoid it if you can, especially if you are managing blood sugar alongside blood pressure. Your palate adjusts within 1 to 2 weeks, and most people find they genuinely enjoy the taste. The clinical trials that showed the strongest blood pressure reductions used hibiscus consistently for at least 4 weeks. This is not a one-night solution. This is a nightly habit that compounds its benefits over time. 4 weeks of consistent use is when you begin to see meaningful, measurable changes in your readings. Now let me ask you something. Do you check your blood pressure at home regularly? If you are trying hibiscus tea, monitoring your own readings weekly is the best way to see what is actually happening. If you do not currently have a home blood pressure monitor, your doctor can recommend one. And tracking the numbers removes all the guesswork. Tell me in the comments whether you monitor at home. I want to know. Now I need to spend a moment on something critically important, because I would not be doing my job if I only told you the good news. There are specific situations where hibiscus tea requires caution or should be avoided entirely. Please listen carefully to this section. First, if you are already taking blood pressure medication, hibiscus tea can have an additive effect, meaning it can lower your blood pressure further on top of what your medication is already doing. For some people, this is fine and beneficial, but for others, especially if your blood pressure is already well controlled, the combination could push readings too low. Low blood pressure in older adults causes dizziness, lightheadedness, and dangerous falls. Please do not add hibiscus tea to your routine without telling your doctor first if you are on blood pressure medication. Second, hibiscus interacts with certain medications. Research has documented interactions with chloroquine, some cholesterol medications, and acetaminophen. If you take multiple medications, as most adults over 60 do, this conversation with your doctor or pharmacist is not optional. It is essential. Third, hibiscus has diuretic properties. If you are already on a diuretic medication, combining it with hibiscus may increase fluid loss more than is appropriate for your body. Again, a conversation with your doctor. Fourth, some people with certain kidney conditions should limit additional herbal diuretics. Your physician is the right person to confirm whether hibiscus tea is appropriate for your specific kidney health situation. And fifth, hibiscus tea is not a replacement for blood pressure medication that your doctor has prescribed. If your blood pressure requires pharmaceutical management, continue that management. Hibiscus tea is a complement to your overall approach, not a substitute. Think of it as giving your cardiovascular system an additional layer of natural support, working alongside your existing treatment rather than replacing it. While you are developing your hibiscus tea habit, let me share 3 things you should pair with it for maximum nighttime blood pressure benefit. Number 1. Drink a modest glass of water alongside your hibiscus tea. Research from Japan found that people who drank water before bed had measurably lower blood pressure than those who did not. Dehydration thickens the blood and forces the heart to work harder. Mild dehydration is extremely common in older adults overnight. A glass of water before bed supports your kidneys in their overnight processing and helps maintain healthier blood viscosity while you sleep. Number 2, keep your bedroom dark. We discussed this in our morning habits video, but it applies here too. Nighttime light exposure suppresses melatonin and prevents your blood pressure from making its essential nighttime dip. Darkness is cardiovascular medicine. Turn the television off. Put your phone face down or in another room. Close the curtains. Dark, cool, and quiet is the target for your sleeping environment. Number 3, avoid sodium-heavy foods in the evening. Sodium causes fluid retention overnight. That retained fluid increases blood volume. Higher blood volume means higher pressure against your artery walls while you sleep. Limiting salty snacks, processed foods, and restaurant meals in the hours before bed gives your cardiovascular system the best chance of achieving that protective nighttime dip. Let me summarize what we covered today because I want you to leave here with 3 clear, actionable takeaways. Takeaway 1. Hibiscus tea is the most evidence-supported natural bedtime drink for blood pressure management. 26 randomized controlled trials involving nearly 1,800 participants confirm its effectiveness, particularly in adults over 50. 1 heaping teaspoon steeped for 10 to 15 minutes, drunk 30 to 60 minutes before bed, is the evidence-based dose. Takeaway 2. If you take blood pressure medication or any other regular medications, tell your doctor before adding hibiscus tea. It has real physiological effects. That is what makes it powerful. And real physiological effects mean real interactions that need to be considered. Takeaway 3. Consistency is everything. The clinical trials that showed the most meaningful blood pressure reductions used hibiscus for a minimum of 4 weeks. Make this your nightly habit, not an occasional treat, a daily ritual that compounds its benefits over time, every single evening. Your heart has been working for you every minute of every day for your entire life. Tonight, let your bedtime routine start working for your heart in return. If this video helped you, please give it a thumbs up. It takes 2 seconds, and it tells YouTube to show this information to more people who need it. Subscribe if you are not already, and hit the notification bell so you never miss a new video. We publish verified, honest, senior-focused health content every single week. And for your next video, check out our video on the 6 foods that lower blood pressure naturally after 60. It is linked in the description below, and it pairs perfectly with everything we covered today. I will see you in the next video. Take care of yourselves and your hearts.